Everyone, good morning, Jeffrey. Today we have the Thai Seafood webinar again, and today is a very special topic. We will talk about just do it, harness surgical videography to boost your career inside and outside the OR. And we have the special guest, Dr. Jeffrey Wu. He is assisting professor at the Department of OB-GYN and Advanced Gynecological Surgery from Eastern Virginia Medical School, Norfolk. So please over to you, Jeffrey.
Thank you very, very much, Alaric. Thank you. I know you're very busy, so thank you for connecting with me on this topic. And thank you all for joining today. So as Dr. Alaric mentioned, my topic is just do it, harness your surgical videography to boost your career inside and out of the OR. So both making you a better surgeon, number one, and then also using that surgical videography to really help with scholarly activity, academics, getting your name to your patients, to your colleagues around the world. As Dr. Alaric said, I'm over at Eastern Virginia Medical School in Virginia, USA. Um, I am part of the ODU, the Old Dominion University system here in Virginia. And again, I am part of the Division of Advanced GYN Surgery. So pleasure to be here. Scripps Clinic here on the left on my presentation slide. That's where I did some of the work when I was a fellow, and that's in California. So disclosure, I am the Surgery U editor-in-chief, so there might be a little bias towards surgical videography and Surgery U here. So objectives, today we're going to discuss the who, the why, and the what, and the how as well. That's going to be the most important is the how. So the introduction of who I am and my story. I always get a lot of questions about this. The why. So we'll discuss why is there a necessity for really high quality surgical video for surgical education. Then we'll talk about the what. What is MIGS Tips? What is this social media handle that I created? And lastly, this is the most important for you all, is how can you all, number one, create an effective surgical video, and number two, disseminate your product to the masses. And of course, that'll be through social media. So again, who am I? My name is Jeffrey Wu. I completed my residency not too long ago in 2019. That was in Virginia, USA at Riverside Regional. I then went on to complete my FMIGS fellowship through AAGL in Scripps Clinic in La Jolla, California. And then I joined Eastern Virginia Medical School, Division of Advanced GYN Surgery in 2021, and I've stayed here since. We started with a group with just me and my boss, Dr. Jay Hudgens, and now we're actually six of us that just do advanced GYN surgery in our division. So very busy and very, very good practice. In 2023, so about 2 years ago, I was elected, or I was appointed, I should say, as the new editor-in-chief of Surgery U, which is a video catalog for education of GYN surgery. So it's a really great resource. I would like you all to join. And it's a video catalog where we show all sorts of videos that we do, or all sorts of surgeries that we do in MIGS. So hysteroscopy, vaginal surgery, laparoscopy, robotic surgery, chronic pelvic pain, non-surgical things. It's all featured, and we have over 7,500 videos of all these techniques on our website, in addition to webinars, and it's a very easy to use website. Please take a look, www.surgeryu.com. And so I'm the editor in chief of it, so I always keep it up to date, make sure that's in tip-top shape. Moving back to the presentation, one question I get asked all the time is how did I get into surgical videography? And so it all started in 2016, so almost 10 years ago when I was a first year resident here in the US and I went to my first AAGO Congress. At that time, it was in Orlando, and I was able to see all the amazing videos, the surgical videos that were so educational, and it was just so inspiring. This year, the conference is in Vancouver, Canada. Please, I encourage you all to join. It's going to be a great time. It's always right before Thanksgiving, so it's kind of mid to early November. But getting back to the presentation, what this did when I saw all these videos was it inspired me to review, record, and edit my videos And I did this throughout surgery. Every time I had a surgery case, I'd always ask my attending and the patient if it's okay to record, and they were always more than happy. I was able to submit my videos in as abstracts to regional and national conferences. And what I learned was I was actually getting, I was winning awards in these videos. I continued to review and edit my surgeries throughout fellowship. And luckily with fellowship, there's not as much obstetrics. And so so much surgery, I had so much content. I decided to create a social media handle called MIGS Tips on Instagram. That's MIGS underscore tips, TIPS. And that stands for minimally invasive GYN surgery tips. And what I learned was that doing this surgical video review and editing was making me a better surgeon. So it was so key for my development as a surgeon. So the why. Why do we need to use surgical videos to in our education? Well, in the US, and I know it's different around the nation, but in the US, there's simply inefficient surgical learning experiences during training. Our training system is very fragile, and we saw this during COVID. There's decreased number of hysterectomies with all the medical management, which is a great thing for our patients, but it makes it difficult to learn and train surgery. There's a paradoxical increase by our governing bodies where they want us to do more hysterectomies. And with 80-hour work weeks for our trainees, which is probably going to decrease down to 40 or 60 hours, like in Europe and Australia, this makes a very, very fragile system for us to learn surgery in a finite amount of time. With social distancing with COVID and the conservation of PPE, 5 years ago, this all kind of came to a crashing halt, and that's when I started my social media at that time. Is when COVID was kind of at its peak. So trainees must utilize every resource that they can at home in order to prepare and educate themselves to get the most out of intraoperative education, and that's exactly where social media, where videography comes in. So as the saying goes, a picture is worth 1,000 words, but really a video is worth 1,000,000 words. So as an illustration of this, I did want to just show you quickly what an operation note for a C-section scar pregnancy resection looked like. And we're going to compare and contrast the operation note compared to an actual video where we have some education. So the retroperitoneum was open, the vesicovaginal plane was open, the bilateral paravesical space and caudal boundaries of the pregnancies were developed using sharp and blunt dissection.
We start by entering the vesicovaginal space and carefully dissecting the loose areolar tissue, revealing the pregnancy below. Our first step was to further develop these surrounding retroperitoneal spaces, including the vesicovaginal space and the bilateral paravesical spaces, to define the boundaries of the pregnancy prior to resection.
All right, so there's step one. So you can see how the operative note just wasn't really all that informative, but putting a video to it really shows so much more. Using judicious electrocautery, the ureter was identified within the pararectal space.
Step 2 is then to locate the ureters. Here we prefer to identify the ureters within the pararectal space at the level where the ureter crosses below the uterine artery at its origin.
And you can see using video and really great illustrations and overlays, it really makes the anatomy pop out. Whereas you really just, if you don't have a keen eye, you wouldn't quite see all that anatomy in this one frame. And lastly,
Next,
the uterine arteries were identified and a lateral window, lower uterine segment window was created medial to the ureters.
we further skeletonize the uterine artery by making a window within the posterior peritoneum medial to the ureter.
Laparoscopic bulldog clamps were placed on the uterine arteries through the windows, taking care to avoid the ureters laterally. Additional bull clamps were placed on the uterovarians, and the exact same steps were completed on the contralateral side.
Using our peritoneal windows, we then place laparoscopic bulldog clamps across bilateral uterine arteries at the level of the cardinal ligament, knowing our ureters are well lateralized. We then place clamps across the uterine ovarian vessels as well. All of these steps are done to ensure hemostasis and minimize potential blood loss during time of resection.
So I'm going to stop the video there. But as you can see, what I was trying to illustrate was how informative a surgical video can be if it's done correctly. And that's kind of what we're going to go through today is how can you make surgical videos into something really compact and educational. So what I created again, is Migs Tips, and that's a social media handle. It's created by myself when I was a fellow over at Scripps Clinic in San Diego, California. And my slogan was surgical finesse for your MIG success, a MIG surgeon target on surgical technique, innovation, imaging, anatomy, all with some music. And I released this social media handle on Instagram, YouTube, and Twitter. So my videos, and there's a lot of them now, probably almost 100 posts, but I really wanted to encompass the GYN surgical breath. So we have everything from simple anatomy to at the top left over here, and I'll kind of zoom up on that, to more complex things like the peritoneum and laparoscopic suturing. I wanted it to be available and useful for and free also for medical students, all the way to more seasoned attendings or those that are, just trying to get more into more complex surgery. And so basic anatomy, like I mentioned, for the keen eye, of course, these type of things you can see and right away. But for more of our early trainees, this putting these highlights with colors and labels really shows all the anatomy and really makes it so much more educational. And we are going to review how to do these in a basic form later in this presentation. Retroperitoneal anatomy, again, focusing more those complex anatomy structures, those vital organs that are hidden, such as the uterine vessels, the ureter, the internal iliac artery. And then I made a lot of videos on basic surgical techniques. So when you're in the hospital at 3 a.m. with an ectopic pregnancy, taking removing that ectopic pregnancy, but making sure you know where those gonadal or infundibulal pelvic ligament is, so that you don't take or damage the ovary as well. Really focusing on those skill sets, and then our ABCs of surgical suturing, knowing where to hold the needle, how to twist it, all those things are so important for surgical education. More advanced surgical techniques. I have videos on how to suspend the vaginal cuff when completing a total laparoscopic hysterectomy, or developing that rectovaginal space when you have a bad endometriosis nodule adhered to the rectum. I didn't just want to show videos of surgery, but I also want to show how to, again, create your own surgical videos. So there's videos that I made on this as well.
It's for teaching, actually. It's really good.
And so this, as my videos evolved, so did my kind of technique and my style. So initially I had videos in the traditional way, 7-minute videos where I was dictating exactly what I was saying. And so it was more of the traditional surgical video, and they're good. I'll show you kind of this is my first post, January 1st of 2020. Again, kind of right before COVID started. But I knew that, it looked like things were, I knew that these would be very important. But again, this was a more traditional way of dictating a surgery. Above the colpotomy ring, create your peritoneal incision. This may require countertraction with an additional grasper. Connect this incision from the contralateral side. So very traditional, dictating exactly what I saw, what I was doing. But what I found was that, the dictation was actually limiting myself. I could actually say and do the same things with more symbols. And to me, stylistically, I felt like it was more of a compact visual of how to do surgery with symbols, arrows, circles, and overlays was a lot more informative. So I developed a more interesting way of doing things. But because there's no visual, there's no audio on these videos, I decided to add music just because it was a little boring without music. And so this is one of my more recent posts.
For a weekend, come with a list like this. Now we can end the story right here. But Shorty didn't quit, it was something in the air. Yeah, he said it was something so appealing. He couldn't fight the feeling, something about it. He knew he couldn't doubt it, couldn't understand it. Branded since the first kick flip, he landed. Labeled a misfit, a bandit. His neighbors couldn't stand it, so he was banished to the park. Started in the morning, one stopped after dark. Yeah, when they said it's getting late in here. So I'm sorry, young man, there's no skating here. So we kick, push, kick, push, kick, push, kick, push, coast. And the way he rolled, just a rebel to the world with no place to go. And so we kick, push, kick, push, kick, push, kick, push, coast. So come and skate with me, just a rebel looking for a place to be. So let's kick and push.
So as you can see, both were surgical videos, but a little different style with the music and the overlays, I felt made it so much more informational. So lastly is the most important part, which is how. How do you all, or how can you all make videos, create an effective surgical video? And number two, you put so much effort into making this video, but how can you show it to everyone, show it to the masses? Because in the end, we all are in the OR, we're all doing laparoscopic surgery, and we're all learning as we, through each case, we're always learning something new, and we're recording or taking pictures, but how can we use those videos, that stuff that we're already doing, we're already in the OR, and how do we use that to create something that can educate others or build our CV, get us academic promotions? This is all so important, right? Because in the end, there's only so many hours in the day, and we want to get the most out of our day-to-day work. And so the first thing is to create a effective surgical video. So basic anatomy, I kind of mentioned this before. This is a picture that a medical student, a junior learner, they wouldn't be able to see what's going on. I mean, everything's there, but the use of overlays is so key to really make something so much more powerful. And so the question is, how do we make that? How can we create these overlays from a simple surgery? And so, in my opinion, anyone can be an amazing surgeon. You just need the proper video editing skills, okay? So I always get this question. I do want to address it. This is a big deal in the US, so I do want to address it ahead of time. But consenting, I always get questions on consenting. And basically, our consent at my institution says that I agree to use for the use of my photographs and video recordings for teaching purposes. I think it's really important with your patients to be very transparent. You may take pictures. They're going to be for educational purposes. You may take videos, they may be for educational purposes. You don't necessarily know if you're going to. It doesn't necessarily mean there's something that needs to be recorded, but you always want to give yourself that opportunity. And just being transparent with the patient is so key. I would, of course, discuss with your general counsel at your institution for more details about what they specifically want. But again, it's variable, it's very individualized, but these are the kind of the key points for that. Here's a kind of a fun video.
Okay, where is our med student? Hi, I'm right here. Okay, what artery is this right here? Um, uh, which artery are you referring to? This artery right here. It's hard for me to see what you're pointing to. Okay, let me try to get you a little bit better exposure. All right, there. Which artery is that? I don't, I'm not sure. The superior mesenteric artery? No, that was a trick question. This is actually the hepatic vein. Please read up on the anatomy before every case, and next time, anticipate my deceit.
And so that's an example of exactly what we don't want, right? We don't want surgery videos that are just so uninformative that you just look at it, you have no idea what you're looking at. It does not help anyone. It doesn't help anyone. And so, I think really breaking down, now that I've done this for a good, almost 10 years now, the keys to an effective surgical video are: it starts in the operating room. You have to plan, 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 plan. Think about a case that's coming up. If it's a really interesting case, like a C-section scar topic, like the video I just showed, You know you're going to have that case. You have to plan and think about how do you want to phrase this surgery. It's going to be like a story. Put some thought into it. Know your technology in the OR. What type of laparoscopic box am I having? What type of USB do I need? Is there a cloud system? Who's going to be in that OR with me? Is it more of my junior residents, or am I going to have a chief resident, a senior resident? Am I going to have a fellow? Because that also really makes a lot of difference in how you can accomplish your goal of making a really nice surgical video. Cut the fat. Now, what I mean by that is our surgeries typically can be 3 hours long, maybe on average. Sometimes it can be 4 to 5 hours, but no one wants to watch a surgical video that is 3 to 5 hours, okay? Especially in this day of social media, TikTok, Instagram, our videos, the sweet spot is about 1 to 3 minutes. Once you get past that, you lose people's attention. So, in other words, how can you, and I will review this a little bit, but you need to learn a technique that I say cutting the fat is just cutting down all that video to only about 3 minutes. So maybe like 90% you're going to get rid of. Okay. And so that's really, really key. And then lastly, adding colored anatomical overlays, kind of like that video, that frame where we have all the anatomy pop out. That's really key to making an effective surgical video, because in your eye, as the person making the video, of course, you know what it is that you're trying to show, but it's showing others in an effective manner is really the key. And you can do this also by adding labels and symbols. And the last thing to really focus on is the pace of the video. If you put labels and symbols on an image and you have 7 different things labeled, you don't want it to go like that, like 2 seconds. You want to hold it there or slowly bring in each, as you can see, I slowly bring in each anatomical overlay sequentially. You wanted to hold it there for probably at least 5 more seconds than you think, so that our brains as viewers can process it. Again, it's different if you make it versus when you are the viewer. So it's important to keep that in mind. But like I mentioned earlier, it all starts with the pre and intraoperative preparation. So before the day of this surgery, you have a big surgery, you're going to ask yourself a couple questions. Do I know how to use my equipment? Is there a proper setting that I need to make sure I do? For me, one of the things that was frustrating is that we use Stryker. We had a Stryker box in the OR, and there's 2 settings you can have the video on: MPEG 4 or MPEG 2. Now, MPEG 4 works for my Apple, which is what I use, and MPEG 2 doesn't. But if I didn't double check and I had a great surgery and I did the surgery and it was an MPEG 2 file, but I need to format, I need to edit on an Apple product, it wasn't going to work. And, there are ways to change it, convert it post surgery, but you're so busy, you have so many things, it's just so easy to check the settings. So always check the settings. And then think about to yourself, what story do you want to tell? Do you want to show the whole surgery, all parts of it, or is there a certain aspect of it that you want to show? And in my opinion, showing a certain aspect of the surgery is always more educational than a whole surgery. So, for instance, I have videos on just how to create that bladder flap during a total laparoscopic hysterectomy, how to create that vasovaginal plane. So you can really focus very intricate instructions on that little video rather than showing every aspect of a video of a surgery. And lastly, kind of like I mentioned, who is your help? Do they know how to optimize an image? Do they know how to focus an image center? Do they know how to clean a lens? Do they know what horizon means when you say check the horizon? All such important things. So again, this is the Stryker box, and I kind of alluded to just knowing your equipment when you walk in, right? So looking at the equipment, you know where to put the USB. Your USB is going to work, right? You know how to create a new case, and as I mentioned, you know how to check the video format. All really important. I like MPEG 4 because I edit in Apple. MPEG 2 is great for PC. And then, of course, hitting that start button to record. Because, as you know, when you're concentrated and you're in the operation room, sometimes you just forget those things. But without the video, you aren't gonna be able to process it. So a couple pro tips throughout this presentation. So the first pro tip is I always have a USB on my keychain. It's encrypted, it works. with my striker box, but always keeping that on hand because yes, you can save it and get it back later, but with how busy we are and how, the hospitals can be 15, 20, 30 minutes away, you aren't going to really come back just to get it. It's just reasonable to just always have a USB on your keychain. Other tips here, a lot of things throughout this video that I'm going to show here is that you cannot change things post-processing. All these things such as focus, cleaning the lens, as much as you want to change that on iMovie or on your Premiere Pro, whatever it may be, it's not possible. So intra-op, you really have to be cognizant of these things. So focus, can't change that post-processing. Cleaning the lens, you can't take out a smudge post-processing. Always keeping that anatomy centered. So make sure the person holding your camera is skilled in that. And then the horizon, right? So you don't want it to be tangential. You want to level it out because that's how we interpret our surgeries. We want things leveled, things to make sense, right? It's really, really important to keep all these things in mind when we do surgical videos. So pro tip 2, as I mentioned, we want a clean lens. Here in the US, I always open one of these. It's just so nice to always have a squeegee to put through the port and something to clean the lens with. Open up one of these. All right, so time to cut the fat. So these are my techniques, and I'm not going to show you as a live demo, but just verbally some techniques on how to make a 3-hour video down to 3 minutes, okay? Because this is so important. So don't be overwhelmed. It is very daunting. Again, this is just like anything else in surgery. It's going to take practice, okay? But the idea is that most of your footage is not usable. In a surgery, there's probably a good 8 minutes of video that you may want, and then you'll cut out another 5. But almost all of it is just not useful, okay? And so most of your footage is garbage. Just realize that no matter how good you are, most of it, the camera cleans, the zoom in, zoom outs, you can cut out all of that. Okay. It's kind of like a 3-star Michelin restaurant. I know, Bangkok has a couple of these, but they focus on less is more. You want to just kind of have those little dishes that are, 20 courses. You want to have less is more. All right. So don't think of me as this mean guy saying you're a terrible surgeon, all your footage is garbage, but think of me like Marie Kondo on Netflix, okay, tidying up. I'm Jeffrey Wu, slicing and dicing, okay? Just clean up your house, clean up that footage. You don't need most of it. And so 4 simple steps to create 3 hours to 3 minutes is step 1. I transform my video, so size adjustment. That's what I mean by transform. And a lot of these terms I'm using are on iMovie or on Final Cut Pro, but adjusting your video, okay, for the size, the color, exposure, saturation. The next step is to make your video 2 times the speed. So I do this religiously. I do not watch my videos or create videos that are 1x. They're always at 2x because in the end, you operate slow, and that's fine. It's fine to operate slow, but when we view a video, we want to see things a little bit more fast, okay? Step 3 is to trim down your videos from 3 minutes to 3 minutes, 3 to 4 minutes, and that's using a blade and delete function. Use your hotkeys, okay? And whatever program you use your hotkeys. Like I said, I am using terms from the Apple products, but these same concepts are very, very doable and apply to anything PC. And then once you cut up your videos, of course, it can be a little choppy between 2 frames. I cross dissolve to give that smooth transition. So those are my tips, 4 big tips. So pro tip, going to throw in my last pro tip here. Know your hotkeys. So whether you're using a PC product or Apple product, just know those hotkeys so that you can function and do your projects faster. Okay. Once you start using them, it'll be like, you'll know them like the back of your hand. You'll automatically just use them. So Next thing I want to do here is an easy way for me to show how to do these video overlays. So what I mean by that is you will have an ovary and you want to highlight that ovary. How do you do that? And again, these concepts are with iMovie and PowerPoint, but you can apply these to any PC product. So first is always going to be color boarding. Second is going to be to screenshot a frame for anatomical overlays. Third is to create that anatomical overlay, and that's on PowerPoint. And then fourth would to be screenshot and return that now anatomical overlay image back to iMovie. And I'll show you exactly what I mean by that. So again, like I mentioned, I'm going to use iMovie and PowerPoint here, and we're going to do screenshots on a Mac. Okay. So screenshots on a Mac, for a PC, it's very similar. There's something called snipped tool, but for a screenshot on a Mac, we do Command Shift 4. Okay. And like I said, on a PC, it's called snipping tool. These are just kind of references, but this is how you would do a rectangular snip. All right. Just some brief things about, how iMovie is created, or the areas of iMovie. There's the timeline, the adjustment menu, but this is what it looks like. So I drag and drop a video into my iMovie. Okay. First step is color adjustment. So if you start cutting and splicing this video and then you do color adjustments, you have to do it many times on each frame. So do it right when you start. So there we color adjusted right there. All right, now it's a lot brighter. Saturation's better. Next step is find a frame on the timeline. So you kind of scroll through the timeline and figure out what frame you want to do an overlay on. In this case, I wanted to do an overlay and I wanted to show the ectopic pregnancy. Okay, so I'm going to scroll on this video of me doing surgery and find that frame. And then what you're going to do is split the clip. So you're going to use your blade or Command D to, at that one point where you saw that ectopic pregnancy, where you want that frame to be highlighted, you're going to split it into 2 clips. So over here, you have 1 clip and then you have 2 clips, and the blade was right in the middle. And then you're going to make that screenshot. So you're going to do, again, Command Shift 4 and take that screenshot on your preview. So it's kind of a click, hold, and drag, and that'll save that screenshot to your desktop. Okay. Now we're on PowerPoint. So again, this is iMovie, but now we're on PowerPoint. All we did here in PowerPoint was we dragged and dropped that frame that was saved on our desktop. So once we got this screenshot, we saved it on, it's automatically saves on our desktop. We just dragged and dropped it into PowerPoint. And then we're going to go to Shapes. And when you hit Shapes on PowerPoint, there is something called a freeform shape. So of course, when you hit shapes, there's the normal shapes: circle, square, triangle, but there's one on the right here called a freeform shape, and I highlighted it in green, and that's exactly what you want to do. It creates a little cursor so that every time you click, it kind of saves it, and it makes a line. So you could do your little cursors very close together. It could be very, very curved, or you could do it longer, and of course, it'll be more of a straight line. But the idea is that you're going to click, 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 click all around this ectopic pregnancy, all the way to where you started, and then it will make a solid object. Okay. Then once you do that, it's usually like just a black circle. What you're going to do is I do no line, solid fill, but what I do change is the transparency. And that's where it kind of makes it a little bit see-through, which is great for our videos. And of course, you can pick any color that you want over here. And then so again, still on PowerPoint, now that you have this overlay, you're going to take a screenshot of PowerPoint. It'll save back onto your desktop. And then you drag and drop and put that right where you had that blade function, that splice. And that way it'll be a smooth transition. Okay. So I know that was a lot, and I have a video of this as well. And this is on my YouTube. If you look up Migs Tips or Jeffrey Wu on YouTube, this video is there. So this is exactly everything I said. It's just in a really compact 1-minute video. Surgical video editing, highlighting anatomical structures. Once footage is in the timeline and color board is adjusted, select a frame on the timeline to highlight anatomy. Once the frame is selected, press Modify, Split Clip, or Command B. You are now ready to take a screenshot of your frame by pressing Command Shift 4. Then drag and drop the screenshot into PowerPoint. Create a freeform shape by pressing Insert, Shape, and Freeform. Use your cursor to outline the selected anatomy. Right-click your freeform shape, selecting Format Shape, select No Line, select a color, and adjust transparency as desired. Take another screenshot of this highlighted structure and drag and drop it back into the iMovie timeline. Press crop and change from Ken Burns to fit, and your video now has a seamless anatomical overlay. And so it's just that simple. And I know there's a lot of steps. I encourage you guys to go to my YouTube or my Instagram. I have this exact video there. It's going to take practice, but it's a very doable and intuitive way to do overlays. Surgical. So now you have your really awesome 3-minute video, but now we always want to know you don't want to just sit there on your desktop. No one's ever going to see it. How do you disseminate your product to the masses? And so that's my next thing that I want to discuss. And of course, that's through the shotgun approach is what I call it. Okay. Shotgun approach. So we have this video and we're just going to put it out there in social media. And then we also are going to put it in scholarly activity. And what I use is something called a recycle and reuse a strategy. Okay. So like I mentioned, the first thing we're going to do is post it to social media. All right. So this is kind of all the social media that is available for videos, in my opinion. I'm sure there's more. There's probably more, but this is all the ones that I've dabbled with. YouTube is a great form of social media. It's a great place to have kind of a catalog of your work, but there's not as much discussion on YouTube, in my opinion. LinkedIn is an awesome way to connect with others, especially internationally, especially when it comes to like industry. I think it's a great way to connect with industry. TikTok is a form of social media. I don't particularly use TikTok. I've tried it. I think it's a great form of social media to connect with patients. But for me, it was always more of my peers. I wanted to connect with trainees. I wanted to connect with attendings, and that's just wasn't the best platform for that. Twitter, that's another great place. I think that they focus more on written work sometimes, not as much imaging. But the one that really I found that connected really well for me was Instagram. Okay. And the reason why this one worked so well for surgical videography because engagement was so key in this platform. Um, I found that Mig's tips on Instagram social media is the most impactful, especially for OBGYN trainees, because number one, Instagram is visually focused. So unlike Twitter, where you might post a scholarly article, on Instagram, you could post videos and pictures, and people were really engaged in them. They're quick posts. So unlike YouTube, where videos can be 20 to 30 minutes long, quick posts on Instagram were great. And then many residents already use this platform. So a lot of people have Instagram already. And so this wasn't like a new website or app that someone needed to download. It was just there at their fingertips already. And so the success of MigTix was likely because Instagram enables followers to share, like, sticker tap, repost, and interact with creators. And they really created a very nice community of learning. This was a really nice day for me in April of 2022, and I had my 10,000th follower. So some examples of engagement that really work well is quizzes. I do quizzes on my Instagram, surveys, a lot of surveys, and then a Q&A, especially on like laparoscopic video editing. How do you record cases? What tips do you have? Because that's a really hot subject right now. So Instagram and residency, just want to mention this, there is so many, I mean, basically all the residents in the US at least have Instagram. And so again, a great way to connect with trainees around the nation to really build your presence. Approximately 90% of the 275 OBGYN residency programs have an Instagram account. And this is not just individual to OBGYN. This is with general surgery, urology, and even non-surgical specialties. So Instagram, my bottom line is Instagram is a great way to connect with trainees around the world. So we have the video, 3-minute video. and we posted on social media. It's on our YouTube, our Instagram. But now, again, it's just a 3-minute video, but we want to go ahead and build more of, with this same 3-minute video, build more of a repertoire and get more bang for the buck, if you will. And so the second thing I do with videos is I submit to societies. So instead of that 3-minute video that's just cut to the chase surgery, I make a 7-minute video where we put slides, educate, have references, right? And so these are kind of all the international uh, international societies that accept videos. A lot of these are U.S. based, but overseas, I'm sure that this is also the case where videos are a big part of conferences. Let's see here. And the third thing that we're going to do is submit to journal publications. So we need a final parking spot for our videos. Unfortunately, once videos and abstracts are presented at conferences, they aren't really published, if you will, most of the times. And so what we want to do is use that same video now that's presented at a conference and get it published, get something on our CV that is permanent, PubMed, if you will. And so these are actually all the mostly American-based journals that accept video publications as an actual publication in print. And so this is kind of my workflow of how I get the most bang for my buck. And I do want to show you just one example of this, okay? And so this is not just something I preach, this is something I actually do. And we've been doing it, for me and my team have been doing it for 4 years now. But this was a video where we reversibly clamped the uterine arteries for a myomectomy. Okay. And then we took out the myoma, as you can see here, and we filled the uterine cavity with methylene blue to make sure that the cavity was not entered, for us to identify where the endometrial cavity is. So naturally, I have this really cool 3-minute video of this, and I post it to social media. So post to social media and you get all the views, right? 8,000 on Instagram, 4,500 on LinkedIn, YouTube, Twitter. And then of course, I want to my next thing, like I said, number 1, social media. Number 2 is societies. Well, I'm pretty busy, so I don't particularly submit these myself to societies, but we have a lot of trainees, right? So my MIGS fellow, of course, wanted to get on this video, and she created a video called Laparoscopic Myomectomy When and How. So this was more about the MIGS perspective, about how you technically do a myomectomy, okay? And then I had an aspiring trainee that wanted to be an REI. And so what he wanted to do was focus more on the RE aspect of it, okay? So how can you prevent endometrial cavity entry? So his name of his video was Preventing Endometrial Cavity Entry During a Laparoscopic Myomectomy with Methylene Blue Uterine Cavity Distension. And of course, sent to the conferences, it got accepted everywhere. Then, like I said, the third step is publication, because sending to conferences is great, but you really want a final parking space, and then it's like it's done. Once you have a final parking space at a journal publication, that's what you need. And so we sent it to AJOG. They weren't interested. Fertility and sterility were not interested. But obstetrics and gynecology was, and of course Surgery U, which I encourage you all to submit videos to, was very interested in as well. So this is kind of my workflow. And once you do get it published at these these journals, of course you send it back to social media and say, hey everybody, my amazing video was published on social media. And then that's the end. That's when I leave it. Okay. Then we kind of just let it be. But this is a really neat way of using, all your time and effort for a 3-minute video. You used it and got it published and recognized multiple ways. Another example of this. Okay, so we had a really interesting surgery where the IUD, the intrauterine device, was found in the pararectal space on the left-hand side, and it was actually entangled, as you can see, with the uterine artery and the ureter. So interesting surgery, and this procedure we did was a total laparoscopic hysterectomy. And so, of course, it was a cool video, so I sent it to social media, and we got a whole bunch of views. On Instagram, almost 10,000. LinkedIn, 3,000. And so the next thing to do, of course, was I wanted to maximize this. But the surgery itself wasn't all that interesting once we took out the IUD. It was just a hysterectomy in the end. Okay. But what we did like about this video was this one image where we had the uterine artery entangled with the ureter, and connected to this IUD. And so what we decided to do is, instead of making a video publication, we went ahead and used this image to try to submit it to journals. And so, as you know, some big journals also have images in gynecological surgery. And one of them is actually the New England Journal of Medicine. So we shoot for the stars. And now they have images, but a lot of them are, image findings like radiological, ultrasound findings, or dermatological findings. But we said, we'll just try out, see if they want a GYN surgical video. Unfortunately, they did not want it. But we tried our best. Again, shooting for the stars. But we did send it to our AAGL JMIG journal, and they accepted it. And they actually liked it so much they made it the cover of the magazine for that month. So my point is that we are doing this in the OR. We are in the OR. We're taking videos. We're taking pictures. But the point is, if you use a little creativity, just know how to do some simple overlays, labeling. You can create scholarly activity, and it's really, really simple. JMIG, the editors, we put colors on, the cover on this image. They didn't even want the colors. All they wanted was labels. And this is very, very doable, especially if you do the PowerPoint iMovie technique that I showed you, or you would just use PowerPoint, period. But I hope that, of course, and then once we got the JMIG article cover, we sent it back to social media, let everyone know how great of an accomplishment this was. So hopefully this was inspiring, okay? But, my concluding remarks are social media, Instagram, they're an excellent venue to educate trainees, colleagues, patients. Surgical editing is an invaluable tool for surgical education, and it should be utilized by all surgeons. We're in the OR. We're already doing it. We might as well get something out of it. Due to the use of mass social media platforms such as Instagram, Twitter, YouTube, they're going to be increasingly important for education. And, using my shotgun approach to recycle and reuse our surgical videos for a variety of posts and abstract submissions is a really efficient technique to maximize your videography efforts. And I hope that this inspires you to get out there and post, to get out there and make images and show others and teach others. Thank you so much, Olaric, for having me talk today, and I hope we all learned something.
Whoa. Thank you,
Thank
Jeffrey, for your wonderful presentation. It's
Thank you.
very
Thank you.
inspiring me, and I think for the other people too. And it's not only in Thailand. I think for the Thai doctor, just only 20%, but some of them are from the Malaysia and from other country, from the UK. And if any people have the questions, so please feel free to turn on your microphone and ask.
Yeah, absolutely. Any questions, I'd be happy to answer.
And before that, I would like to share now. I try to use the CapCut. Okay,
Yeah.
is another program. Okay, that I use on my mobile, and we can use on the iPad, or even now
Yeah.
there is a program on the Mac and
Yeah.
PC. Okay,
Yeah.
and
CapCut's a really neat program.
and CapCut is very smart because of the AI can select which that they want to zoom in or zoom out. That's very smart. The AI is very smart, so it's maybe it decrease the time that used.
Yeah.
So I do have the question, Jeffrey, and do you have a plan to have the workshop in the AAGL? Because of most of the doctor, they said, okay, we are the surgeon, we don't have the editor skill, how to use the program. So do you have the plan to use and the doctor bring their own computer or Mac to the AAGL? So what do you think?
Yeah, that's a really great question. The question was, we only have so many hours in the day, right? So we're all surgeons, we're all busy in the OR. How the heck am I going to learn how to use another program like
Yes.
iMovie and all that? And it's something I brought up with AAGL several times. Last year, we did have in the exhibit hall, we did have a surgery use session, which was really, really well received. It wasn't quite as much as a workshop as I wanted. It was kind of more of a lecture like this. But absolutely, if you see me at AAGO, I know Alaric's there every year, so I'm excited to see him. But if you see me there, I'd be happy to kind of show you things, some shortcuts, and just kind of how I do my workflow. But as of now, we do not have an official kind of sit down workshop, unfortunately.
Because when I talk to Thai doctors, okay, they will buy the new MacBook, okay, they will buy the program. Actually,
Yeah.
my personal, I use the Final Cut Pro.
Yes,
before.
that's what I used to. Yes.
But they want to know where is the button where I have to click.
Yeah.
It's like training the resident step by step.
Yeah, it's really annoying and it's going to take a lot of time. For me, unfortunately, kind of to your point, I had to self-teach a lot of it. YouTube, Google. But once you know kind of those 7 buttons that you need to edit surgical videos, that's really all you need. I don't really use some of the more fancy functions because our needs as surgeons aren't quite as complex as a true videographer.
Agree, totally agree. Just only the 10% of the function that's enough.
Exactly. Yeah, yeah. And it does it so well.
And last but not least, are there any comment? Let me some doctor from Qatar, okay, from Malaysia, from Qatar. Okay, and Jeffrey, please invite all of the audience to follow your social media and for the AAGL, please.
Yes, please. My social media again, I'm gonna write it here in the chat, but it's Migs_tips, and that's on Instagram. And then on YouTube, I think you can just Google my name, Jeffrey Wu, or Migs Tips, and you'll be able to find me as well. But it was a pleasure. Thank you everyone for taking out the time out of your busy days. And Alaric, I'll see you in November in Vancouver, and have a great time in Venice.
Thank you, Jeffrey. Okay, ส
Bye
วัสดี
bye.
ครับ บ๊ายบาย bye for all
Bye.
bye